Again, you talked to me a little bit about dissatisfaction at your job placement. Um, what are some of the things that you're experiencing that you feel dissatisfied about?
Well, one thing is my pay. I can't really live off the amount of money that I make right now with my job, so it's not really a job I can pursue in the future. And I have some problems with some of my coworkers as well. Not all of them, but a couple of them.
Do you want to explain that a little bit further? Like what's going on with the coworkers?
It's not really their personalities or whether I like them or not, but sometimes I feel they have a lack of concern of what I'm doing. They don't really put enough effort in when they need to at certain times.
Now, would that be in regards to how they treat you, or just what they're doing with their own jobs?
What they're doing with their own jobs.
Mm. So they're not putting in on you're putting in more work than they are, essentially.
Sometimes, yeah. When there's a lot of patients, a lot of them seem to just keep doing their responsibilities as of billing, but they're not taking their priorities in the right direction.
Mm. Do you ever express any kind of
Not really,
concern to them?
because it's not my place to tell them what to do.
Definitely understandable. That's be able to be a manager's responsibility, right?
Yep. But he's a whole other story, really.
Mm. I can understand. Management can be like that sometimes.
Mm-hmm.
They have a strict rhetoric of what they need to control and what they don't need to control and all that other stuff. So generally, when you're at work, do you not feel happy? You don't feel. Well, how do you feel about being at work?
Yeah, I definitely don't. I don't really feel happy at work whatsoever. Not really ever. Well, I shouldn't say ever. Some people or patients make me laugh sometimes and pleasant, but most of the time I feel like I'm not really contributing enough as well.
And is that because the work environment is kind of toxic, or is it because you're asked to do more than you think you should be doing? Or kind of just explain it in your own words.
I wouldn't say it's toxic, but I think I can contribute more to life than what I'm doing as of right now.
You know, I like how you put that. You think you can contribute more, and how would you like to contribute more, like in a professional environment?
Well, I'm going back to school to pursue radiology. I think a radiologist therapist to help cancer patients.
It's excellent. Very cool. How did you kind of figure out you wanted to do that?
Well, I knew I wanted to stay in the medical field because I like helping people. And you can pursue it doing a 2-year and a 1 year for a bachelor's degree. And I think I could just generally help people that way.
What kind of drives you to help people? Is it something that stems from your upbringing, or?
No, it's just a personality trait. I like doing it.
Very cool. The human, as a therapist, that's part of what I do as a human service agent, is to help people with their problems, and that seems like a very similar job that you could really do a lot of good for other people. And you said you're going back to school.
Mm-hmm.
Do you have any? Are you nervous about that? What are your feelings about going back to school?
Yeah, I'm kind of nervous. Not maybe as much as I should be, but it's a weird way to put it. But
why do you say that?
maybe because I wasn't really successful in school in the past, but I had no motive or desire for what I was pursuing in the past. So that has a lot to do with it, but now I do. And I have a reason for going.
Cool. So when you were in school in the past, what were some of the thoughts that you would, tell yourself? Why weren't you motivated, or what was,
Because honestly, I was just immature. Didn't really have a passion for anything. I I was kind of just going through the motion of doing it because I knew it had to be done.
That's what other people might have expected of you to do.
Yeah, exactly.
Can definitely understand that. Not to take any of the time during the session, but it took me a long time to go back to school because that's what everyone wanted me to do. That's what you're supposed to do. You have to get a college degree and to make more money and all that kind of stuff. So it can be, expectations can be difficult sometimes. Did you ever feel that when you were in school, you doubted yourself, or you had any kind of, negative thoughts about yourself while you were in school, like you couldn't do it, or,
I didn't really have any negative thoughts about myself. I don't usually doubt myself or my capability too often. But being around other people while we're trying to, while we're in class, that always kind of had an impact on me for some reason. I don't know why. It just does. Maybe it's just a social thing, awkwardness. I don't know. But
yeah. I have a similar situation when I'm in class. Sometimes I think, in my head at least, I would think that other people would be judging me.
Yeah, but they're really not.
But they're really not, right? So it's important to recognize what you might be thinking as opposed to what other people are probably or maybe not thinking.
And you just cram together, and just like 30 of you, and if you ask a dumb question, people are like, "Oh, what the hell?" And,
Yeah. So let's go back to that. If you ask a dumb question, or the concept of a dumb question, that's how you decipher. That's what's in your mind, right? You think it might be dumb, so you would assume that other people might think it's dumb.
Mm-hmm.
So in my profession, we call that a maladaptive thought. A thought that might not necessarily be true, but it's coming from somewhere. Maybe it's a little bit of self-doubt. It just could be nervousness or anxiety that you might be experiencing in that moment. So do you feel a little bit anxious sometimes when you're in class, or?
Oh yeah, definitely. Sometimes.
How does it make you feel to be anxious while you're around other people?
It doesn't really make me feel. Doesn't really make me feel too bad or too emotional, but I don't really know how to explain it into words of how I feel of anxiousness, because it's you're anxious, so it's kind of hard to describe,
Mm-hmm.
Like how would you describe being anxious?
Yeah, no, it's tough because it's very individualized. Everybody's anxiety is very personal to them. When I get anxious, I feel very tight, almost like my body can't move. I'll start to maybe tap my leg, repetitively, or I might grind my teeth a little bit, or freezing up, I think, is the perfect way for me to describe anxieties. That my brain just starts rambling and starts going in different places instead of focusing on the task at hand. Does any of that sound familiar with your anxiety?
Yeah, it does. That was pretty well described too. I should take some notes.
I think people who experience anxiety, they have a lot of similarities in it as well. It might be, it's situational. Like I might experience anxiety while I'm driving, and you might experience it while you're in class. But anxiety is it's tough to master sometimes.
Like I cannot public speak to save my life. That's a real problem for me.
Mm-hmm. I'd have to admit that public speaking is very tough for me too. What are some of the things you think about while you're public speaking?
My mind is usually just blank. I don't usually think about anything, and that's the problem. My mind just goes blank, and it's hard to speak in front of large groups of people. For me, it is. And I had to do it in some of my English classes too, and it's really, really hard and tough. And my hand shakes, and oh man, it's pretty bad.
That's very similar to the anxiety we were talking about before, right? Is that feeling of, it's like a restlessness feeling. You feel like you can't really move, and you feel like you can't focus. That loss of train of thought, essentially. And public speaking is hard. I think a lot of people experience like deficits when they're trying to public speak. There's a lot of people. They say, what's that quote that they say? Picture everybody in their underpants.
That does not help.
That exactly that does not work. You know, it's a lot bigger than that. So when you're at work, do you ever feel anxious or do you ever feel nervous?
Not really at work anymore. If I do something for a certain amount of time, I get, let's say, confident or cocky, and I feel like I can do anything. So that's just how I am. So say I spoke for months at a time, I'd probably feel comfortable doing it multiple times.
Well, good. That might that may mean that it's just a comfortability thing with you. You know.
Yeah, maybe it's an anxiety. Maybe it's just getting through the hurdles, I should say.
Mm-hmm. Kind of facing the adversity and trying it out a couple different times, and then after that you can kind of go forward, at least mentally and physically, because you know we experience some physical traits of anxiety. You can go forward with that and be better in that situation in the future. So when you said you're applying to a radiology program,
Mm-hmm.
what is the application process like with that?
Well, I have to go through the radiologic technology through HVCC for the first year or two. Then I have to transfer out into an accredited school to take another year or two there, and then I can take the test and then get certified.
Okay.
So it's going to be a long process.
Yeah, definitely a long process, but it seems like you just said, once you get into the flow of it, you'll get comfortable, and then you almost feel extra confident about what your abilities, which is a good thing. Confidence is very important in life, as you probably know. So when will the process maybe begin after the applications? You have to wait some time, or would you start in the spring, summer, fall?
Well, I'm going to start October 24th for my prerequisites.
What do those entail, the prerequisites?
Chem, biology, and I have to take one more math class. I already finished my English classes back when I was 18 or 19, so I just have to take those and take physics. Physics is going to be a tough one, for me at least.
I hated physics.
No one really likes physics.
Yeah, I mean, you got to think that you know there's some brainiacs in the world that do, but for me at least, I'm sure it's going to be maybe similar to you, but it's one of those courses you got to pass and you got to get through and move on to the next.
I had to take a lot of physics classes too, not just one. I had to take two or three of them.
Wow. Okay. So you said before that you've been to school in the past and you kind of weren't motivated enough to kind of finish. And then what's changing that about this time?
Well, working in the environment that I currently have right now, you kind of learn and understand that this is necessary, and you have to you have to go to school in order to make enough money to survive. That's part of it too.
And is any of your motivation not necessarily based off money? Is it more of a passion of yours that you found?
It's somewhat of a passion. I definitely know I want to be in the medical field to help others with certain and just to have good relationships with people. And that's part of it as well.
So social skills and people skills is something that's important to you to develop over time.
Yep.
And in your profession.
Mm-hmm.
Cool. How about in your social and your family life? Do you socialize a lot with others? You have cousins and friends and stuff that you hang out with?
Yep. I talk to them often.
So you kind of translate some of the skills that you used with your family and your friends into your social and professional environment. That's kind of